Have you ever heard someone say that if an older man goes too long without ejaculating, he's putting his health at risk? It's the kind of advice that spreads quickly between friends, shows up online, and leaves a lot of men wondering if they're unknowingly hurting themselves. The truth is a little more complicated than that. Some men worry because they no longer have the same sex drive they had years ago. Others are widowed, single, dealing with erectile dysfunction, or simply not interested in sex as often as they once were. And then there are those who wonder if they should force themselves to ejaculate because they've heard it protects the prostate or boosts testosterone. If you've ever had those questions, you're certainly not alone. And before you make changes based on rumors or headlines, it's important to understand what your body is actually doing. My name is Dr. Nerita. And for the past 16 years, I've had the privilege of helping thousands of older men better understand their health, confidence, and quality of life. Every day, I care for men who ask these same questions in my clinic. Today, I'd like to explain what we truly know, what we still don't know, and what really deserves your attention. Before we begin, if you enjoy practical, evidence-based men's health information, please consider liking this video and subscribing to the channel. And I'd love to hear from you in the comments. What's the biggest myth you've ever heard about men's health after age 60? Let's start with the biggest misunderstanding. Many people believe that the body works like a pressure tank. They imagine that semen simply keeps building up until it becomes harmful if it's not released. That's an easy picture to imagine, but it isn't how the male body works. Your reproductive system is much more like a well-managed workshop than an overflowing container. Sperm are produced continuously inside the testicles, but they don't stay there forever waiting for release. If they aren't ejaculated, the body naturally breaks them down and recycles many of their components. It's an efficient process that's been part of human biology all along. That means not ejaculating for weeks or even months doesn't automatically create a dangerous buildup. Your body has ways of maintaining balance without forcing anything. This surprises many of my patients because they've spent years believing the opposite. They often come into my office worried they've somehow damaged their prostate simply because they haven't been sexually active for a while. Fortunately, the answer is usually reassuring. Now, that doesn't mean ejaculation has no relationship to health. Some research, including work discussed by organizations like Harvard Medical School and the American Urological Association, suggests that men who ejaculate regularly over many years may have a slightly lower risk of certain prostate problems. But it's very important to understand what that actually means. These studies show an association, not proof that ejaculation itself is the reason. Men who are sexually active often have other healthy habits. They may exercise more, sleep better, manage stress differently, or have fewer chronic illnesses. Those factors also influence long-term health. So if someone tells you that skipping ejaculation is directly causing disease, the evidence simply doesn't support that claim. At the same time, if ejaculation happens naturally through sexual activity or masturbation, and it's comfortable, safe, and consistent with your personal values, there's generally no medical reason to avoid it. For many men, it can be a normal part of overall well-being, but here's where the conversation becomes even more interesting. In my experience, many older men become so focused on how often they should ejaculate that they overlook something far more important. They spend weeks counting days on a calendar while missing the signals their body is quietly sending about blood flow, hormone balance, medication effects, and overall cardiovascular health. Think about it this way. Imagine your car's dashboard warning light comes on, but instead of checking the engine, you spend all your time polishing the hood. The hood matters, but it isn't what keeps the car running. Your sexual health works much the same way. Changes in ejaculation frequency are often not the problem themselves. Sometimes they're simply clues pointing towards something deeper that deserves attention. And one of those hidden issues is so common in men over 60 that many don't even realize it's happening until it begins affecting far more than their intimate life. That hidden issue is circulation. Many men think of blood circulation only when they hear about heart disease or high blood pressure. But healthy circulation also plays a major role in sexual function, urinary health, healing, and even energy levels. In fact, the blood vessels that supply the penis are much smaller than the arteries that feed the heart. Because they're smaller, they may show signs of trouble years before heart symptoms appear. I've had many patients tell me they assumed a change in their sexual function was simply part of getting older. While aging does bring changes, it's not always the whole story. Conditions like diabetes, high cholesterol, smoking, obesity, and uncontrolled blood pressure can gradually reduce blood flow without causing obvious symptoms at first. Imagine watering a garden with a hose. If the hose slowly becomes narrower from mineral buildup, the water doesn't stop all at once. The flow weakens little by little. Your blood vessels can behave in a similar way. That's why paying attention to overall vascular health is often far more valuable than worrying about a specific number of ejaculations each month. The encouraging news is that many of the same habits that support your heart also support healthy sexual function. Regular walking, strength training, eating plenty of vegetables and healthy fats, managing blood sugar, and getting enough sleep all work together to help your body perform the way it was designed to. Another topic that causes a lot of confusion is testosterone. Some men believe that avoiding ejaculation will cause testosterone levels to climb higher and higher. Others think frequent ejaculation drains testosterone and leaves them feeling weak. Neither idea is supported by strong scientific evidence. Testosterone naturally rises and falls throughout the day. It also gradually declines with age for many men, although the rate varies from person to person. Factors like poor sleep, excess body fat, chronic stress, heavy alcohol use, certain medications, and untreated medical conditions usually have a much greater impact on hormone levels than ejaculation frequency alone. If you're feeling unusually tired, losing muscle strength, noticing a major drop in sex drive, or struggling with mood changes, it's worth discussing those symptoms with your healthcare provider. A simple evaluation can help determine whether low testosterone or another health condition may be contributing. What I don't recommend is trying to force your body into a schedule because someone online claimed there's a perfect number of ejaculations each week for every man. Your body doesn't follow a one-size-fits-all calendar. Some healthy older men have an active sex life. Others are perfectly healthy and ejaculate much less often. Both situations can be completely normal when they're consistent with the individual's health, comfort, and personal circumstances. There's another point that often surprises people. Stress and anxiety can sometimes create more sexual problems than the lack of ejaculation itself. When a man becomes preoccupied with whether he's doing something wrong, his body may remain in a constant state of tension. That stress can interfere with sleep, reduce desire, make erections more difficult, and even affect relationships. In other words, worrying about the myth can end up creating very real problems. Instead of focusing on fear, I encourage my patients to pay attention to how they actually feel. Are you staying active? Are you sleeping well? Do you have good control of chronic medical conditions? Are you maintaining regular checkups? Those questions usually tell us much more about long-term health than counting the days since your last ejaculation. And before we finish, there's one more important piece of this conversation that many men never hear in the doctor's office. It has less to do with ejaculation itself and more to do with when a change in your sexual function should be considered a signal to seek medical advice rather than simply accepting it as part of aging. That brings us to the question I encourage every older man to ask himself: has something changed? A gradual shift in sexual function over many years can be a normal part of aging, but a sudden or significant change deserves attention. If you've noticed persistent erectile dysfunction, pain with ejaculation, blood in the semen, pelvic pain, difficulty urinating, or a dramatic loss of sexual desire that doesn't improve, don't assume it's just getting older. These changes can sometimes be early signs of conditions involving the prostate, hormones, blood vessels, nerves, or even side effects from medications. The good news is that many of these problems can be treated or managed, especially when they're identified early. One of the biggest mistakes I see is waiting too long because of embarrassment. Many men tell me they delayed bringing up a concern for months or even years because they thought it wasn't worth mentioning. Then they're surprised to learn that there were practical solutions available all along. As doctors, we've heard these questions countless times. You're not going to shock or embarrass your healthcare provider by talking about your sexual health. In fact, those conversations